So, good afternoon. This is American Surgery Center, December 9th, Wednesday at 3 p.m. This is our weekly event, live session for our bariatric patients who already have bariatric surgery or who are going through the bariatric surgery process. My name is Kemal. I'm the chairman of American Surgery Center, as well as the chairman of United Medical ACO. I have Dr. Isaias Irgau with me. He's our program director, and we are going to discuss another topic today with all of you. And I'm going to start sharing my screen. And so from our point, this is our volume 15. We try to divide these topics into smaller sessions so that way you can watch them all together, or you can just watch 3-4 of them based on where you are in your process. And today we are going to do vitamin use after weight loss surgery, why it's important, and Dr. Irgau is going to tell us and educate us what needs to be, what patient needs to do and what they may be going through. So as I mentioned earlier, we are the co-founders of American Surgery Center. We have a partnership with CHRIAS, our mothership from this surgery standpoint, and our wonderful surgeons outside of, other than Dr. Irgau, Dr. Wynn, Dr. Peters, Dr. Singh, Dr. Ibrahim on the bariatric side, and we have Dr. Wade on the colorectal side. But I would like Dr. Irgau to introduce himself so then we can start.
Thank you, Kemal, and hello and good afternoon, everybody. I am Dr. Irgau. I am the president of the Christiana Institute of Advanced Surgery, or CHRIAS. My specialty is weight loss surgery or bariatric surgery. I have been performing bariatric surgery now for almost 20 years. Alongside my associates that Kemal introduced, we have been doing bariatric surgery for the longest period in our area. We are actually the most experienced group when it comes to weight loss surgery. We've set up centers of excellence, not only in our surgery center, the American Surgery Center, but also in the area's main hospitals. So when it comes to bariatric surgery experience, the Christiana Institute of Advanced Surgery has been there for the longest, and it has the most experienced surgeons as well.
Thank you, Dr. Irgau. So we have, before actually I go back to our presentation, our dietitians, I forgot to mention. Oh, all right. So I do usually introduce them because they work with our patients before and after the surgery. Fran, Amy, and Beth, they are fully supporting our bariatric patients, as I mentioned, before and after. And tonight, actually, there's a diabetes event. In case you have, you are a patient with diabetes and going through our bariatric process, Wednesday wellness webinar tonight with Amy at 7 p.m. It's an online event, and you can find the event details on our social media pages. Now, what we know as of today is that there are different stages for the bariatric surgery. And as you can see here, we call this bariatric surgery journey. And then from the time that you get your referrals from your PCP or you come to us directly, you go through so many different clearances and finally you get your surgery. We then welcome you to our wellness program at that point. So life after bariatric surgery requires certain specific guidance that you have to follow. And again, as I mentioned, we are going to have Dr. Irgau to explain these to us. Now, Dr. Irgau, I would like you to kind of take it from here. So now, why do we need vitamins after surgery? I'm going to start with the simplest question from our side.
Sure, absolutely. So Kemal, essentially vitamins, right, are needed regardless of whether has had bariatric surgery or not, right? Vitamins are a part of the so-called micronutrients, which are nutrients that we need in very small amounts, but absolutely necessary elements for the healthy working of our cells, for our health overall. Generally, nature provides those micronutrients for us as long as we are eating fresh foods, healthy foods, right? However, in a society like ours, which is so far different from the societies of our ancestors, where they grab their food directly from the garden, in a society like ours, where we eat a lot of processed food, a lot of stored food, the access to those essential micronutrients is limited. Therefore, most of us living in these societies will need vitamins. And it's not a surprise that multivitamins are sold in stores and they are popularized, and many people take multivitamins. So that's really the background. Well, then we emphasize micronutrients and vitamins for after bariatric surgery, because some changes that occur because of bariatric surgery make really the importance of vitamins and micronutrients even more. And that is for two reasons specifically. One is that after bariatric surgery, the actual volume of food that we consume decreases, right? That's a good thing. We want people to eat less. Eating too much is part of our problem, right? We want to decrease that. But when we were eating a lot of food, whether by choice or not, somehow we were getting a proportion of those micronutrients, a proportion of those vitamins through all those foods that we consume during the day. When the amount of food, the volume of food that we are consuming is much smaller now after bariatric surgery, the fraction of micronutrients contained in those foods is going to be smaller as well. Therefore, knowing that fraction is very important, and putting a lot of attention in that fraction is important. Therefore, we will have to pay attention to the types of foods that have the greatest amount of those micronutrients, because the amounts are limited. So because we are reducing the total volume of food, the vitamins become super important for us after bariatric surgery. The second reason why vitamins have to be an important consideration for us is because the changes we undertake in the digestive system with the surgery, let's take the two common surgeries that we do, gastric bypass, for instance, where we make the stomach smaller, but also we reroute the intestine so that food that we eat does not actually go through some of the most active portions of our intestine as far as digestion and absorption is concerned. So we're going to be taking on and absorbing much less nutrients even from the food that we eat. Even if we look at sleeve gastrectomy, where we remove a good portion of the stomach, the ability of the stomach to make some changes to the food that we eat so that the micronutrients like vitamins are readily absorbed is also altered. Because of those alterations, the availability of vitamins and other micronutrients in our food is going to be much less. So we as bariatric surgeons know that our bariatric patients are at risk of becoming vitamin deficient after bariatric surgery unless we put a lot of attention on educating our patients and telling them how to get those vitamins, but also monitoring their vitamin levels after surgery. Looking at those vitamins specifically, we talk about vitamin B12, folic acid, vitamin D, and sometimes thiamine as the more important vitamins that people are at risk of being deficient. But there are other micronutrients like minerals, like iron as well, that we pay attention to, and we can talk about that as well. So educating our patients before surgery when they go through the nutrition on the importance of being mindful about their vitamin intake is a very important part of our preparation. And following up on our patients on how they are doing with their vitamin intake and monitoring that with blood tests is an important part of our post-bariatric surgery engagement with our patients.
So, Dr. Irgau, you mentioned something earlier with if the patients are able to get this without taking vitamins, right? So just from the fresh food and what we are if we are careful what we are eating, is it possible that someone with the bariatric surgery, after bariatric surgery, can still do that with the right choices of food, or do we definitely need vitamins?
No, we definitely need vitamins, Kemal. The access to absolutely fresh food, extremely rich in micronutrients in our society, is just not there. So even with the most careful patient, as far as choice of the food is concerned, additional vitamin supplementation is essential. The best way to ensure that as a basic intervention is to have everyone take multivitamins. So take one multivitamin a day, for instance, right? That would be the baseline. Beyond that, most patients, particularly patients who had gastric bypass, will need additional B12. Sometimes they may need additional folic acid as well. Most likely they will need additional calcium and vitamin D, and particularly for young women who are still having their menstrual period, they will most likely require iron supplementation as well, because they are at risk of being iron deficient. So because we know the issue of deficiency is common, all our patients from the get-go, the first time when we see them, actually, even at the consultation, Kemal, as you know, we order a panel of blood work, right, lab tests, and that blood work includes vitamin levels as well. So from the get-go, when the patients come to our door for the first time, we want to know how they're coming to us. Are they coming to us very depleted with their vitamin levels, or do they have a reasonable reserve of vitamins? And the blood test that we do tells us that. The most common deficiency that we find is vitamin D. And many of our patients, even before they get bariatric surgery, they will find actually that we call into their pharmacies vitamin D supplementation to make sure we correct that deficiency.
Sure. Dr. Irgau, the other thing is that I believe it's important for our patients to know we do follow FASMBS guidelines when it comes to bariatric surgery and before and after.
Yes.
Part of that requirement, which you and I are trying to change the name for it, is the life after bariatric surgery. And rather than calling our patients a patient, if they are a member of the wellness program. Now, what that is that even after you start losing weight, we do need you to come and see our surgeons or nutritionists on a regular basis, and nutritionists on a regular basis, so that we can actually capture what's happening in your body and how it's changing and how it's responding. Dr. Irgau, for example, in some cases with some of our female patients, they may have some hair loss after the surgery, and correct me if I'm wrong, but if it's still not known whether it's coming from the surgery or the stress of the surgery. So, but even for us to be able to help, we do need our patients to follow the specific appointments that we already set up at the discharge. So, Dr. Irgau, can you talk about that a little bit more?
Absolutely. So essentially, as you correctly said, bariatric surgery is very different from the other surgeries that we do because of that long-term relationship that we must maintain with our patients after the surgery. As you know, we do other surgeries like gallbladder surgery or appendix surgery or hernia surgery, right? So the patients come in with a problem, we fix that problem, and then we don't see the patients, they go back to their primary care doctor. But when we do bariatric surgery, because we know those changes that we make with the surgery have a lifelong impact on our patients, we want to establish a lifelong relationship with our patients. Of course, in the first year after surgery, we will have frequent visits with our patients. But after that, we want to see our patients at least once a year, provided everything is going well, once a year. And one of the reasons we do that is because we want to follow up and monitor their nutritional status, particularly when it comes to micronutrients. Of course, the macronutrients are also important, things like protein. You mentioned hair loss, for instance. One of the reasons we feel that hair loss can occur, particularly between the 3rd to the 6th months after bariatric surgery, particularly with a surgery like gastric bypass or the duodenal switch, is because hair is one of those tissues in our body that has a very fast turnover. It grows, we cut it, and then more grows, and we cut it, right? For that turnover to happen, you have to have the things that make up the hair readily available, and one of those things is protein. So if somebody's protein intake is not adequate, they may find that their hair is not growing as quickly as it ought, or it thins out, right? So one of the ways to minimize that occurrence is to make sure that their protein intake is adequate. But correctly, as you said, micronutrients are also important. They are important in many areas of our body. For instance, if somebody is vitamin D deficient, right, they could have weakness of their bones. If somebody has a folic acid or B12 deficiency, they could even develop things like poor healing, but also damage to their nerves. So there are real consequences to having the low levels of these vitamins. So it is very important that we proactively monitor those things for our patients. And that's what we do, obviously, with the follow-up. So when we say we want to follow up our patients for life, it's not because we think patients will have problems necessarily. It's because their health really can be optimized only when there is an experienced bariatric program following them up, recognizing deficiencies earlier on, and recommending corrections of those deficiencies. And some patients feel that they have the surgery, they lose the weight, they feel great about their weight loss, they've achieved the goal weight, their diabetes is gone, the blood pressure medications are not needed anymore, sleep apnea is gone, they feel great and they see no need to follow up with us. Well, I say absolutely you must follow up with us, because your nutritional status needs to be followed up on a regular basis. And what we do is we do with the blood test at 6 months after surgery, and then yearly after that, or more frequently if needed.
So I think the adaptation of the new lifestyle after the surgery especially is the key, right, Dr. Irgau? So
yeah,
we are going through a lot of different steps to get the surgery. It's so great that we see our patients losing, like the patient with 320 pounds, like 8 months later, they are 220 pounds, only if they're following certain specific guidelines that we provide them. And then after that point, it becomes lifetime changes that we need to adopt, and it's extremely important from that point. So I can't emphasize enough how important for patients to follow through after the surgery, so that we can keep an eye on what's happening in their life. Now, with the Dr. we did mention the vitamins and the deficiencies, but of course, we cannot forget the water intake, right? So after I shared this a couple times, so people were asking me on the direct message, what's in Kemal's water? I did explain this, but I do want to just, I took a picture this morning. So this is, I think it was Dr. Ibrahim's session, so on this one. So what's in this water? So like there is the ginger, there's only 3 things. And I think this is good for also our bariatric patients too, because there's no harm in any of these. There is the part of the ginger, cucumber, and the mint. So it goes right in the middle of this, and it helps you to drink a lot of water. So that's what's in my water. So in case anyone is wondering. So the other thing that I want to mention is the digital health, especially with the COVID-19 and the pandemic that we are going through. This is extremely important for us to find different resources for our patients, and we are providing this in different ways. We do telehealth, telemedicine, as well as we do several live events, webinars. And on our YouTube channel, right now, it's almost like a TV channel here, because we have so many different topics in bariatric. You can find everything there. We are getting great return from our responses from our patients. So this is really good that we are able to do it, but I want to make sure that patients are also maxing out their benefits from these, and hopefully we can do more, and we do need more feedback so we can do these even better with different topics. Dr. Irgau, would you like to add anything before we?
Yes. So yes, absolutely, Kemal. So what I would like to say essentially is that multivitamins and certain specific micronutrients are very important after weight loss surgery, right? So that is going forward. And the ones that are very important in terms of specific micronutrients, one of them is vitamin B12. The other one is calcium. The other one is vitamin D. And sometimes iron supplementation may also be necessary. Now, when patients are engaged through our program, there are certain preparations that we recommend that will have all those components in a good combination so that patients don't have to take too many of them through the day. But even without taking the combinations that we have in our office, if patients can take regular multivitamins to begin with, as well as calcium to begin with, right? That will be a good start. And then we will be monitoring the other things like their vitamin D level, their iron level. And as I said, particularly iron tends to be more important in women who are menstruating because the levels can go down. Vitamin D is a deficiency we see very, very frequently. And in many patients will actually order a very high dose for a short period of time, like 50,000 units to be taken once or twice a week for up to 12 weeks, and then we will put them on a maintenance dose of 3,000 international units to be taken daily. That would be for vitamin D. Similarly, for B12, we will recommend a regular dose, but sometimes if patients come depleted, we'll actually accelerate with a higher dose to begin with. In some patients, absorption may be a problem. So some patients may take even an injection of B12, and patients do that already by going to their doctor's office and having a monthly injection of B12. For severe cases of iron deficiency, sometimes iron transfusion may also be necessary. But all these are important micronutrients that cannot be overlooked after bariatric surgery for the person to stay healthy for the rest of their life.
So is there any difference, Dr. Irgau, for the B12, whether or not you get the injection versus you take the pills?
No, from a maintenance point of view, Kemal, if you take the B12 by mouth or sublingual, either 500 micrograms or 1,000 micrograms a day versus having a 1,000 micrograms injection once a month, that's actually, there's no difference in that respect. Having said that, in situations where somebody presents with really very, very low, dangerously low levels of B12, we may recommend an injection on a weekly basis until their levels come up, and then we can put them on a maintenance dose after that.
So the other thing, Dr. Irgau, something like this, maybe even bigger boxes for daily intake, that probably would be helpful, right?
Absolutely, absolutely. So one of the problems, obviously, like any type of supplement or medication intake, is compliance. And compliance is really affected by many factors. It's not necessarily that people are disinterested or not paying attention. It's just life gets in the way sometimes, and it's not. It's easy for people to forget, right? So it's important to have a regular schedule of the day of when you're going to take your multivitamins. Just like we have scheduled activities to take care of our own personal needs, whether it's brushing our teeth or eating at a certain time. If we set a time in which we take our vitamins, that is more likely to make it something that will happen as opposed to something that we forget. And then the other important thing also is that we are fortunate enough to be in a time in which the preparations of vitamins actually come in different ways, whether it's in flavor or consistency. For instance, sometimes some people have a hard time swallowing a pill, so maybe something chewable may be better. And in some situations, there are also other ways of administering multivitamins. So we have different ways of doing it. The important thing is that we are consistent in doing that.
Right. Well, Dr. Irgau, thank you so much again. So we'll be back next week, same time with another topic. Tonight, as I mentioned earlier, we have Wednesday wellness webinar at 7 p.m. Friday, we have a session for overall COVID-related updates, and we'll be back soon. Thank you so much again for joining us. Bye-bye.
Bye-bye.